Let's talk thyroid health. Let's talk about hypothyroidism, which is the most common form of a thyroid problem. And it's seen much more than hyperthyroidism. So we're going to deep dive into that. Now, it is a fallacy that men don't have hypothyroidism. The statistics are as such: 1 of every 5 women will suffer from hypothyroidism at some point in her life, and 1 in 10 men. And these are staggeringly huge numbers. So whether you're someone who has hypothyroidism or not, you need to hear this and you'll know why. First of all, what is thyroid? It's nothing but an endocrine organ that's sitting in front of your neck. It's sitting in front of the collarbone. An endocrine organ is one which produces its own hormones and then sends these hormones into the blood, into the various tissues and organs of the body. Now, what does the thyroid really do? It takes care of your metabolism, which means weight. It helps with temperature regulation. It helps with bowel movement. It helps with fertility. It helps keeping your nails and skin not brittle and dry. It helps with cognition, helps with brain fog. You take the system, and thyroid is something that's going to be a master hormone in regulation. Do you know that the commonest cause of hypothyroidism is Hashimoto's? Most people are not even tested for Hashimoto's. They come and ask me, how does it matter? Our TSH levels are normal. But Hashimoto's is an autoimmune condition, which means that your body's own immune system is attacking your own tissue, in this case, the thyroid organ. Now, this is important because in conventional medicine, we are taught, and I was taught this too in med school, that the only thing important is to look at the TSH number. So the lower the number, the better the control. But the fact is, Hashimoto's is not a thyroid disease. It's an autoimmune condition which is affecting the thyroid, which means we need to change the way the immune system works. If you do that, you'll see a significant drop in your autoantibodies. Now, I have a lot of people who also come to me saying that our TSH values are absolutely normal, low normal, but we are still continuing to suffer from these problems. I want to tell you, you're not crazy and you're not imagining these symptoms. So don't worry, just focus on what you can do to improve your immune system response towards your thyroid, and there are lots of things that we can do for that. And you will feel much better. What can trigger inflammation and actually cause Hashimoto's? Well, there are several factors. Gluten sensitivity probably topping that list. Also, look at your gut health, especially if you're somebody who's got constant issues with belching, burping. If you've been diagnosed with irritable bowel syndrome, that means you've got dysbiosis, and 20% of the T4 to T3 conversion, which is the active thyroid hormone, happens in the gut. So you make sure your gut is functioning absolutely optimally. Especially with mercury, arsenic, lead, all of that will cause thyroid dysfunction. Stress can also increase your cortisol level, which can affect your thyroid. Major transitions in life, be it menopause or pregnancies, can also increase and decrease estrogen level, which have a direct effect on thyroid. Insecticides, pesticides, use of plastics, all can affect the way your thyroid functions. Excessive exercise, if you're someone who's trying to work out really hard in the gym or elsewhere in the name of weight loss, it'll actually increase your cortisol level, which will have a direct negative impact on thyroid functioning. Stress levels, chronic stress can actually cause an endothelial dysfunction, which can cause a leaky gut. It can also cause leaky brain. Certain medicines like oral contraceptives, lithium, which is given for depression, can also cause and affect the way your thyroid functions. And a ketogenic diet. Ketogenic diet does not support insulin, which means it will almost certainly worsen the way your thyroid functions. And last, goitrogens. Goitrogens are certain foods that are not supposed to be had when you have thyroid issues, but the fact is only raw goitrogens, which are strawberries, peanuts, and if you're someone who's constantly having detox kale, smoothies which are not cooked, you're asking for trouble as far as the thyroid functioning is concerned. Now, if you're someone who's been diagnosed with Hashimoto's, or you have a family history of hypothyroidism, or you just have elevated thyroid antibodies, the first thing that you need to do is give up gluten completely. Why? Because in any of these 3 conditions, when you eat gluten, your body identifies gluten as a foreign object, and the immune system goes and attacks it and creates inflammation. While doing this, it will also attack your thyroid organ, and it does so because of what's called molecular mimicry, because the structure of gluten and the thyroid is very similar. So this can also cause dysbiosis and can predispose you to getting hypothyroid and Hashimoto's. You know, people always come and say that my grandparents ate wheat and survived on wheat and everyone was absolutely okay. The fact is, the wheat that our ancestors ate was heirloom wheat. The wheat that we consume today is dwarf wheat. This wheat is very high in a protein called glycoprotein, and glycoprotein is hugely inflammatory and can exacerbate any of these symptoms. So stay off gluten, do yourself a favor, and you will reduce the inflammation and your thyroid will function much, much better. So if you have any of these symptoms, just write in the comments below whatever you need to ask me about thyroid, and I'll try and answer as many as possible.